Hello, welcome everyone. We'll just allow a few moments to let people join our webinar session. Welcome to our first webinar Wednesday of 2025. Can't believe we're already into a new year. My name is Melissa McVie, and it's a real pleasure to be with you as the Ontario Association of Resident Councils kicks off another year of learning through live webinars. Once a month, OARC welcomes special guests to help us dive into various topics. And these topics have been identified and they've come to us directly from residents. We know that residents and resident councils play a very important role when it comes to long-term care home operations. And as such, they also provide important insights when the Ministry of Long-Term Care visits their homes for inspections. Today, we'll be having a conversation with guests from the Ministry of Long-Term Care's inspection branch to learn a bit more about the inspection program, some of the recent enhancements, and how inspectors work with resident councils. But before we get started, I have a few announcements, and I'd like to invite you to join me in an Indigenous land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the land that we are on today, from wherever we are participating virtually in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and the unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past, as well as ongoing challenges, and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. Thank you. Now, you likely noticed when you logged in that today's session is being recorded for educational purposes, and it will be made available to participants following today's session. I know we often get requests for the accompanying presentation slides as well, and our guests have generously agreed to make this possible for us as well. And I'll just mention that the presentation today includes some references to policy, as well as some statistics that are a snapshot in time. So this is more intended for education, and just to keep that in mind for future reference. You'll also notice that the chat box has been disabled, and we really encourage you to direct any questions to our question and answer box. That functions on your screen, and it'll allow us to prioritize and keep all the questions in one place. And I also wanted to mention that in order to keep your personal information protected and to maintain a safe space and a confidential space, we ask that when you do pose a question, not to include any personal identifiers or home information if possible. And if your questions or concerns are of a personal nature, to maybe direct that to the ministry directly following today's webinar. Now, we received some excellent questions through our registration, which we're thrilled about. And I'm very encouraged because many of the questions in the areas of interest have been incorporated into the development of today's webinar session for you. But we have protected some time at the end of our webinar to try to get to some that perhaps haven't been covered. And without further ado, let's dig into our highly anticipated webinar topic and welcome our guests. I am thrilled to introduce Al Plant and Tammy Simonowski, Senior Regional Managers from the Ministry of Long-Term Care's Inspection Branch. Al oversees the Toronto and the North District homes, and Tammy oversees long-term care homes in Hamilton, Central West, and London districts. Thank you both for being here for this special learning opportunity for residents. And Tammy, I think you're helping us to get started today, so I'll hand things over to you.
Perfect. Thank you, Melissa, and thank you everyone for the invite today. On behalf of Andrew and Al and myself, it's a pleasure to be here. So just going through what we'll cover in our presentation today, we're going to talk about the inspection branch itself, our inspection process, what's new in our inspection process, compliance assistance, and inspection findings. So about the inspections branch. So you'll see at the top there, we have the Minister of Long-Term Care. So currently our minister is Minister Kusindova Bashta. And actually last week she just gave birth to a baby boy. So she is currently off spending some time with him. And Minister Kalandra is actually providing coverage in her absence currently. Then we have the Deputy Minister, who is Melissa Thompson. And then we have four divisions within our ministry. So our long-term care operations, system planning and partnerships, long-term care policy, and long-term care capital development. And then underneath that, we have, you'll see there, 4 branches. And those 4 branches fall under the long-term care operations division, which is where we fall. So you'll see there the long-term care inspections branch. And along with us, we have the funding and programs branch, our service system planning and operational issues branch, and then our operational policy and implementation branch. Okay. So as modern regulators, our inspectors commit to honesty, integrity, respect, objectivity, confidentiality, continuous learning, and timeliness. We are all trained to be transparent, proportionate, targeted, and professional.
Thanks so much. Just let me get myself off mute. Welcome, everyone. It's a pleasure to meet you all and see you all. So with regards to the kind of work that we do in the home, so the kind of actions our inspectors might take in a home is based on the risk that we identify when we inspect things. We spend most of our time in the bottom 2 sections looking at education, outreach, and kind of looking at some reporting that we have from the long-term care homes. When we're inspecting, the majority of the time we're issuing written notifications if we do find non-compliance. That's of a lower risk. We would take that action or remedy non-compliances, something more of a conversation in the home. Where we find higher risks of issues where the issue affects many residents or the issue has actually injured a resident or has the risk to injure a resident, those are times when we would take more severe action, like a compliance order, requiring the home to provide us with plans or issuing monetary penalties where we find non-compliance that's kind of ongoing, that's of a serious nature. And then the thing we probably spend the least amount of our time doing, and this is a good thing, it means that there are a small amount of like really serious concerns, and we all spend our time investigating. We have a team of investigators of 10 investigators in the province who will look at very serious issues and look towards prosecutions. And there's also some actions that our director might take in the way of director's orders. So if you were to look at the Long-Term Care Homes Act, throughout you will find the mention of the director throughout the regulations and the act, and that director has power to take action against a licensee where they find there to be a very serious issue. So director's orders, things like the revocation of a license, the placement of a manager in the home where we find there to be serious concerns with the leadership in the home or the management of a home. So those are kind of the layers we see. And again, we really aim to spend most of our time, and we do, providing education, compliance assistance, and written notifications and those kinds of things on the lower level issues, but where we find serious issues, more punitive action is taken. So the Residents' Bill of Rights, and this is here, and it's really important that you all understand this, and I urge you in your next meeting even to read through this and have a conversation about it. It's the thing that anchors all of our inspectors as they consider compliance in the long-term care home and the impact that non-compliance might have on all of you as residents. And so I'm just going to read it because I think it's important that we kind of read through it. So the fundamental principle to be applied in the interpretation of the Act and anything required or permitted under this Act is that a long-term care home is primarily the home of its residents and is to be operated so it is that a place where they may live with dignity and in security, safety, and comfort, and have their physical, psychological, social, and spiritual and cultural needs adequately met. A really important part of the Residents' Bill of Rights. It's the fundamental thing that anchors the Residents' Bill of Rights. And so you would have all have read, you might have read the Residents' Bill of Rights, and it's a good, perhaps in a Residents' Council meeting to kind of start reading through some of those Residents' Bill of Rights. But this is the principle that underpins it all. So a really important piece in the Long-Term Care Homes Act. And okay. And I think so. Okay, so there are a couple different kinds of inspections that are happening in the home. So we have what should be known is that all of our inspections are unannounced. The long-term care homes are not aware of when we're coming into a home on any given day. It's always a surprise to them when we enter the home, unless we had been there the day previous and we'd started an inspection. So you should know that. And there are a couple of different kinds of inspections that we do. There are reactive inspections, and those reactive inspections are done in relation to complaints that we might receive from families, you as residents or members of the public that come to us and raise concerns about the operation of a long-term care home or the care of a resident. And we also have critical incidents that are occurring in the long-term care home. What's important to know is there's a significant reporting obligation for incidents that might happen in a home that the Act says, licensee, you must tell us about it when these things happen. Things like injuries to residents where they're sent to a hospital, an incident of abuse, a system breakdown or an emergency in the home that might involve the loss of power or major systems in the home. I won't go, it's a very long list, and the reporting obligation is significant. And so we're receiving this information all the time and making an appraisal of that and determining whether or not we need to do an inspection because there's something there of great concern. And then we have proactive inspections. So our proactive inspections are kind of broad-based inspections, and the intent is to look at a home. No, we're not going there for an incident. We're really trying to understand whether the home is operating and its systems are operating. So it's more organic. We will be speaking to many residents, families, staff in the home, looking at records in the home. Its focus is to really understand whether the home is operating particularly well and that staff are doing what they need to do and essentially that the systems in the home are working well. So those are the two types of different inspections. And I think the next slide talks about a couple different more. So this is a breakdown, and there's a couple other things here that we do in the home. So this is what I've talked about. So we have complaints inspections, critical incident inspections. And of course, anytime we issue a compliance order, we follow up on an order to make sure that the home has come back into compliance. So if we said, hey, licensee, you need to do something or stop doing something, we go back and make sure that by the date that we've told them to stop doing it or to do it, that they're in fact complying with that. So sometime after an order is issued and a compliance due date has passed where we've said you must be compliant by this date, we follow up with the home. And then, of course, there's the proactive inspection that I talked about. The other thing that our teams are involved in, and while not an inspection, it's a really important component of what we're doing, and we're doing a lot more of it now, and that's pre-licensing occupancy assessment. So before a long-term care home can be opened, we must enter the home and make sure that a safe home has been built for the residents who will arrive, and also that the appropriate staff are in place, that procedures in relation to the operation of the home, so that everything is in place. So when we enter these new long-term care homes or renovated long-term care homes, we expect that the only thing missing is residents, and that we have a really safe place for the residents to start entering. So it's just a really important piece of our work that we're doing. And obviously, you might have heard of, announcements about more and more long-term care homes opening, and we'll be doing a lot more of this in the future.
Okay. So about our inspectors. So our inspectors have a current registration in good standing in the following registrants. So they either have to be a registered nurse, a registered dietitian, a registered physiotherapist, a social worker, an occupational therapist, or a speech language pathologist. All of our inspectors complete an extensive training and job shadowing prior to being able to conduct inspections on their own. So our training program generally lasts about 9 months to a year. They have to go through a certification and pass all of the certifications to be able to inspect on their own. They are required to wear name tags and identify themselves upon arrival. So as Al mentioned, all of our visits are unannounced. However, once they do arrive, they will meet with the leadership team in the home, announce that they are in the home, let them know why they're there, so what type of inspection they'll be conducting, and generally an anticipated length of time that they will be inspecting in the home. When they speak with staff, families, and residents, they should also be identifying themselves during those conversations as well. And our inspectors are determining compliance with the Act and the regulations. So they do not provide advice or recommendations on how to comply with the Act and regulation. Okay. So our inspection process. So our process actually starts off-site while the inspector is preparing to go into the home. So they complete an inspection plan, and in part of that process, they're contacting a complainant in some cases. So when we receive complaints, if it's a complaint inspection, the inspector will reach out to the complainant prior to entering the home just to gather more information, understand what their concerns are, and use that as part of their planning prior to going into the home. And then once they enter the home, they will begin their information gathering, and that's really kind of the heart of the inspection. So in that process, they really look at 3 kind of data sources. The first being record reviews. So they'll take a look at residents' clinical health records. They may look at, documents that might have temperatures recorded or any kind of required documents that the home is required to document upon. So air temperatures, maybe food temperatures, or any type of documents that might be helpful, relevant to the inspection that they're there for. And it would include things also like the home's policies and procedures. So those are just a couple of samples of what the record review might entail. The other thing they will look at is observations. So if it's possible, they'll do some observations. It might be a meal service or dining service. It might be related to a care to a particular resident. It might be sort of in relation to a resident's plan of care specifically. So where possible, they will conduct observations to help support their information gathering. And then lastly, interviews. So interviews is a big area in which our inspectors will conduct. It may be directly with residents themselves where possible. It could be families, it could be staff. In some cases, it may be some external partners. whether it be physicians at the hospital or hospital staff. It might be Ontario Health, maybe it may be related to admission processes, and then we would contact them as well. So it just depends on who might be relevant to the inspection. Under the inspection powers, they do have the power to request any document, talk to anyone, and it's the obligation of the licensee to produce or comply with those powers. So some of the tools the inspector might use. So often when you see inspectors in the home, you'll see them with a computer or a laptop, where they're generally entering all the information they're gathering directly into our confidential database. So we have our own database in which they enter the information. As part of that database, the inspector can access inspection policy or inspection guides that might help guide them throughout the inspection process. And then once they determine whether the home is compliant with the act or not, if they determine some non-compliance, they'll utilize what we call a non-compliance decision-making tool. And really that just helps them determine the scope and severity of the issue and land an outcome. So as Al mentioned before, it could be a written notification or a compliance order. So it just helps them get to an outcome after they've finished the information gathering. Okay, next slide. So near the end of the inspection, so I'll kind of go through this, but this is where you may have started to see a little bit of change in the last little bit. So this past year, we really focused on a leaner process, especially as it comes or is related to our inspection reports. We started out trialing it actually in our Ottawa district. So some homes would have probably for the last 7 months of experienced this. And then as we moved and as we kind of fine-tuned the process, we rolled it out across the rest of the province. So once all the information gathering is completed by the inspector, they move on to the report writing. And where you may have seen this change is previously, once we did our information gathering, we would leave the home, we would step away, the inspector would work on the inspection report, and it would be a few weeks before the licensee would or the home would receive the inspection report. Now what you will see is the inspector, once they complete the information gathering piece, will begin writing the report while they are still in the home. So they will complete the report while they're in the home. They still have the report reviewed by their manager, and they will complete the exit debrief and serve the licensee report while still on site where possible. There may be a few occasions because of maybe flights that the inspectors need to catch, or perhaps it's something more serious where we need to have our legal services involved. So there might be an exception where the report is not served at the same time, but for the majority of the inspections, you should see the report being served on the last day the inspector is in the home. And I'll get into a little bit more around the improvements and the reasoning why we've kind of shifted to that manner. And then once the licensee report is served, we do create a public report, which is then posted on the public website. Okay. So residence council. So a highly functioning residence council is really a key contributor to positive outcomes for residents. So FLCA, the Fixing Long-Term Care Act, requires every home to establish a residence council made up of only residents of that long-term care home. Okay, next slide. So as Al mentioned earlier, we have proactive inspections, and part of those inspections, an inspector will speak with the resident council president. They'll review notes from the previous council minutes, usually the last 12 months, And they'll verify that the home is responding in writing within 10 days of the council's concerns. During a complaint or critical incident inspection, the inspectors will speak with the residence council members if there's any connection between the complaint and critical incident and the residence council. So there may be times when inspectors are in the homes conducting inspections and they may not speak to the residence council if the complaint they're inspecting on isn't related to the residence council at all. And then residence council members are welcome to approach and speak with the inspectors at any time when they are in the home. So for example, if an inspector is in, you have conversations with the inspector, and then the inspector leaves and goes about the rest of their information gathering, and you think of something else, by all means, at any time while our inspectors are in the home, you can go up to them or reach out and ask to speak with them. So always feel free to do that. So what's new? So improved communication. So part of that lean process I was talking about is there's a greater transparency with the home while we're in the home inspecting. We're sharing the findings with the home immediately as soon as we're finalizing our information gathering and coming across any issues or concerns that we might find. We've received a lot of feedback from homes that have been in the process a while and those that have just started with it across the province. Really one of the more prominent feedback information we're receiving is that they're liking the transparency. They're liking knowing right away where they can make some corrective action sooner rather than waiting for a report to kind of begin any responses. The other thing that we've really focused on is our inspection reports. So making them more concise and easier to understand. Often in our previous reports, you'd see quite lengthy reports. And sometimes it's difficult for homes to understand really what the issues were. And so in a response, we've really tried to make them more concise and easier. As well with the communication that they're having on site, a lot more opportunity for the home to ask questions, to kind of walk through that report together so that there's a clear understanding prior to the inspector leaving the home what the real issues are. The licensees are required to share a copy of the report with residence council, and licensees must post a copy of the report in the home and must respond to the council's concerns. The other key thing in this process is inspectors are spending more time speaking with residents. So hopefully you'll see that in your homes as well. Okay, recording interviews. So a new policy was created in 2023 that requires inspectors to record certain conversations in the home. And there were several benefits that we've seen by implementing this process. It allowed for more accountability for inspectors and home staff. It increased the accuracy for our inspectors. And it also increased the engagement with the person that they're interviewing. So it allows the inspector to have more of a conversation with the person, knowing that they don't have to capture everything immediately, that they can go back and listen to the interviews at a later date. And often, like I said, increase the accuracy of the inspector's interviews. Okay. Compliance assistance. So one of the things we often have heard over the past few years is around the sector requiring more compliance assistance. So the need for support around compliance issues and how to come into compliance when a home is struggling to be in compliance. So a new and multi-pronged compliance and assistance initiative is underway to help homes to improve their compliance outcomes. And this is going to help homes that may be experiencing or having a lack of understanding around the regulatory compliance activities. So this initiative will build on the ways that inspectors have always provided compliance assistance. So we do it now, it's just not broadly exposed, I guess, or framed under a compliance assistance way. So when we get concerns, either critical incidents or complaints come in, we have triage inspectors that go through that information and often communicate directly with the homes. And often that's the point of first contact with our ministry. And there's a lot of conversations with that can help homes in many different manners. So that is one way. Inspection interviews, our exit debriefs that I mentioned, with them being at the home, again, more conversation, more ability to ask questions about what this means, or provide more examples of some of the areas in which they're struggling in. Our inspection reports themselves. So although compliance orders may be seen as a punitive measure, they're really an opportunity for the home to get into compliance, to understand they're providing them specific steps to get into compliance. And so by fine-tuning some of those things, that will help in that manner as well. And then our post-inspection report meetings, which I talked about as well. So in addition to the existing support we provide, the new initiative will include some data analysis, some inspector training, as well as support and resources for the sector. So we do have some data analysis in which we gather, which we'll be having conversations directly with homes based on what we're seeing so that they know prior to us coming into the home where they might have some areas of concern that they need to pay more attention to. So that's one example. Our inspector training. So as I mentioned earlier, we had implemented the recording of interviews. So one benefit from that as well, it is also allows us to do a quality assurance on our end. And one of the things that we have noticed is the inconsistency on how our inspectors approached interviewing. So one of the things, we'll be focusing on this year is interviewing after interview. So that's just one example of some of the ways that we'll be able to provide that assistance moving forward. And then the support and resources. So one of the things that we will be focusing on in the upcoming year is one-to-one support to individual homes on voluntary basis. So homes that are really struggling to come into compliance. We are going to set up a team of compliance staff who are able to support them from a compliance lens one-on-one. So looking at potential resources out in the sector. So maybe there's other homes that have had similar issues that they can lend ideas around some of those things, developing resources that they can tap into or direct them to resources to possibly look at what might work for their home. Each home is kind of unique in how they can approach based on the circumstances of that individual home, but sharing those ideas, what might work for those homes as well. So to guide our work in this area, we really relied on feedback from ministry inspectors, but as well as sector representatives. So there is an inspector advisory group, which is comprised of frontline expertise and guidance, which provides feedback to the ministry, as well as we engage compliance assistance engagement panels. So it's a forum for the sector representatives to engage with MLTC leadership and staff, and really an opportunity to share some of the feedback. And really, this was one of the big areas that for a while now, since we shifted years ago from a compliance advisor to inspectors, where we've heard the sector really needs some assistance and support. So that's kind of the direction. You'll start to see a little bit of a shift, and some of those things start to come into play for long-term care homes.
So as we were preparing for this webinar, we met with your resident representative, and they asked for a lot of data, which is great to hear. They wanted to understand a bit more about what's the outcome, like what's the so what part, what's the outcome of what we do in the home, how much of it do we do? And so based on those conversations, we've pulled some information together, which really represents kind of recent history. And so what you're looking at here is some, it's the culmination of what we do in terms of the volume. So when we look at compliance orders, and I'll just pause here for a second, compliance orders, when inspector decides to issue a compliance order, they have to think about three things. Did it affect more than one resident? Did an injury happen to a resident, or was there a risk of injury? And then they have to look at compliance history. Has the home done this before? And so based on that kind of those three factors, the inspector might determine that a compliance order needs to be issued. And so for a long time, plan of care, orders related to plan of care have been the number one top non-compliance in the province. And certainly, I think it will remain there. We really kind of determine whether or not the resident received the care that the plan of care said they should get, and where they haven't, we often find compliance orders. The next kind of level is the infection prevention and control. For obvious reasons, post-pandemic and during the pandemic, we spent a lot of time appraising whether or not the homes were compliant with infection prevention and control practices. We continue to do that at present. Every time an inspector enters a home to do an inspection currently, we're assessing whether the home is compliant with good infection prevention and control practices. And then skin and wound care, the third on the list. We often find where residents are not receiving a good skin and wound care, the outcomes can be significant. And as a result, we see a significant number of compliance orders, about 6% compliance orders. Air temperatures, I will say gladly that this is mostly an issue of the past couple of years. Air temperatures were issued 5% of the time for compliance orders. Homes now are air conditioned, and while we'll still do find non-compliance with air temperatures, it's getting less and less common, and I expect that this will not show up if I was to pull this in another year. Doors in a long-term care home. So doors in a long-term care home, it's important that residents, that where there are non-resident areas, kitchens where dangers might exist with chemicals, that residents can't inadvertently gain access to areas that might be unsafe to them. And so this is an area where we continue to work with homes to make sure that the door systems in the home lock, specifically with, access to stairwells and chemicals. So this is something we pay a fair bit of attention to. Accommodation and services. So those are the programs that relate to the care that residents should be receiving. And again, on the top 10 list with 5.1%. Dining and snack services is something we spend a fair bit of time looking at. Food is important to everyone. It's really important to residents, and we know that. And we hear a lot about food, and it's important that we look at it. So certainly it's part of our proactive compliance inspections. And when we receive complaints about food and the dining and snack service to residents, it's something that we look at. Training in the home. So this is another area where we issue a fair number of compliance orders. There is a significant training burden for long-term care home licensees. It's important that the people providing the care and providing the services in the home understand what they're doing and how to do it and what their obligations are. And so this is another area we issue non-compliance to. Safe and secure home. Many times that, might be an issue with, safety in the home, particularly maybe infection prevention and control practices, another area kind of where this shows up. But, maybe there's an unsafe sidewalk, or windows open beyond what they should be opening to. So those are areas kind of where we see the home become a risk to the residents. And then the nutrition care and hydration program. So our residents kind of receiving what they should be in terms of nutrition and hydration at the time when they need it? Are they being assessed? And so this is another area where we find compliance issues, but more significant risk for obvious reasons. Next slide. The other thing we were asked about is to kind of look at the distribution of non-compliance as it relates to regulations, particularly regulations in relation to the residence councils and how it differed between for-profit and not-for-profit homes. So you can see here the distribution is not that far different, but there is a nuanced difference here. So for for-profit homes, 56.9% of the time, we find those homes to be non-compliant with resident council related issues, and then 43.1 for-profit. And I should fix what I just said. Not every time we look, of the non-compliances that we issue, 56.9% are for-profit and the 43% not for profit. Not every time we look. I want to fix that. The next slide, please. Okay, so when inspectors are finding non-compliance related to residence council, so I talked a bit earlier about, the different sanctions that could be issued, compliance orders, written notifications, and non-compliance remedied. And just a real quick explanation of non-compliance remedied. You can consider that to be something very, very low risk. The inspector finds it, and we say to the licensee, if you're able to fix this before the end of this inspection, whatever that issue might be, we're going to issue a remedied non-compliance, but it must be corrected before the inspector leaves the home, and it must be a very low risk. So that's a tool we use 4.2% of the time, and the remainder are written notifications. So again, a lower level issue in the home, a non-compliance that we expect the home to kind of receive the notification and come back into compliance with. Next slide. So a bit about kind of what we're finding. So residence council, so 52% of the time, we're finding non-compliance in relation to the survey. We continue to kind of look at these things every time we get into the home, specifically for proactive compliance inspection, to make sure that that improves. The powers of the residence council, 36.1% of the time where we issue non-compliance in this area is related to the powers of the residence council. The duty of the licensee to consult. So we want to make sure that licensees that are making decisions in the home are consulting with the council. So 4.2% of the time we're finding non-compliance there. Next slide. So less frequently, and so just the residence council. So that relates specifically to, does a residence council exist? Is the licensee trying to establish a residence council? Really important. We don't see it a lot, but it is really important that where one doesn't exist, that efforts are being made to establish a residence council. Information for the residence council. So we want to make sure that the council has exactly what they're supposed to have as set out in the regulation. We don't want licensees interfering with residence councils, and so we see that rarely, 1.4% of the time. Attendance of the licensee and staff at resident council meetings, if they're invited, if the council wishes that to be, to a less degree, less than 1% of the time, we find non-compliance with that. The licensee's duty to meet with the residence council. So there's an obligation there for the licensee to do exactly that. And so rarely we find that, but we do find it. Residence Bill of Rights, and then finally the residence council assistant. So we really want to know that the council is aided by an assistant, and that's actually occurring. Next slide. I think this is just a culminated list of what I just described. So you can see that we're really looking at the details of how the councils are operating and making sure that the council has the assistance that they need. And so we look forward to kind of doing that in the future. But should you be speaking with an inspector and there are concerns, those are the kinds of things that they might be looking at. With that, I think we're into a question period.
Excellent. Thank you so much. That was a really informative session, Alan and Tammy. I think a lot of the questions that came in through registration have been touched on through your very thorough explanations and the accompanying slides. I wanted to take a moment to introduce Anne Donaldson, who is a director on OARC's board, and she wears a second hat as an active member of OARC's Resident Advisory Group. So that's a provincial group known by the acronym REAL, Resident Expert Advisors and Leaders. We've called upon Anne today to help read some of the questions aloud that have come in through the registration, prioritizing questions that have come through from residents. We also have a number of questions that have come through the live Q&A feature. So I think perhaps we can flip between the two and invite Tammy and Al to answer them to the best of their ability, recognizing some questions might not be within scope and we might run out of time. So we will keep a list of the questions that we don't get to and endeavor to follow up as well. So Anne, do you have a question at the ready that you'd like to kick things off with, or shall we start with, okay.
Yeah, one of the questions that was asked was, how often are inspections done? There are like 700 or 800 homes in Ontario. There can't be 700 or 800 people working at the ministry. So how often are inspections done?
So that's a great question. So at minimum, every home gets an inspection every year. I would say that's the minimum. Many homes receive more than one inspection. I will say that it depends on the home. We have some homes that are operating really, really well, that all the care is amazing and the residents are happy and well cared for. And I would say in some of those homes, we spend less time because there's less to bring us there. And so we talked about the critical incidents and complaints that we receive. Those are really the driver of the frequency, and along with kind of what we see in the background from data that we get from different places about, resident assessment and other indicators that might kind of bring us there of our own doing. So proactive compliance inspections is another one. I would say typically inspections likely happen more than once a year, but there are a handful of homes that are really, really doing well, who we might see a lot less of. Tammy, I don't know if you had any other thoughts on that.
Yeah, no, that sums it up perfectly, Al.
Okay. Melissa, do you want to take one of the messages in the question and answer? You're on mute.
Thank you for that. Okay. So there were a few questions around timing and about when the timeline from which that there's a case where the 10-day count for meeting minutes to be received started the day or after 10 days from the meeting versus 10 days from when the administrator receives the resident council minutes. So in terms of responding in a timely manner. Sorry, I'm muddling my words.
That's okay.
Trying to paraphrase here, because there's a few homes that have hit this this area that's been a bit confusing, because I've always interpreted it as the day one being the count starting after the administrator receives and has time to reflect. There's 10 minutes.
Yeah, and you're correct. It's once the administrator receives the advice or concern from the residents council, that's when the 10-day clock starts. Because they wouldn't know what the concerns were without that information. So it doesn't start until they receive that, and then the 10 days will move out from there.
Okay, thank you so much.
Yeah.
Another question of interest, and it's about the credentials of the inspectors that are invited to be trained as on the team of inspectors. Has there been any thought of having an inspector with a background in therapeutic recreation programs, activation? You've got a kind of a wide breadth of qualifications, clinical.
Yeah. Yeah, all of our inspectors are with, like I mentioned, registered colleges. That is not one that to this date I think has been considered in the past. I don't know, Al, if you're aware, but as far as I know, it hasn't been up to this date. But I do know recreation is an area when we're looking at PCIs and we're looking at some newer things this year. One of the things that is considered, just because it's not an area that comes up a lot, but that's a great question.
Yeah, thank you. Thank you to
Yeah.
the home that shared that. And do you have another question you'd like to get
Yeah,
back?
in as much as inspections are, well, they're not planned. Do the homes know when an inspection is going to happen? No. Okay.
No, they
So
do
in
not.
as much as they don't know, is there anything that the residents council and or home can do in preparation for something like that?
So great question. So, and I know Tammy and I were talking about this earlier. I think whenever an inspection starts in the home, number one, if you have concerns about kind of something in the home or you have questions to the inspectors about what they're doing, I urge you to kind of be open and ask those questions. Don't fear kind of bugging an inspector. I think it's important that obviously we will reach out if we're doing a proactive compliance inspection. You're going to hear from us. But one of the things that you can do is if you're being interviewed by an inspector, is if you have something else to say that you think, oh, I'd like to kind of clarify what I said there, or I'd like to add something more. I urge you to kind of try and reach out to the inspector. If you don't see them, flag a staff member down. They'll be able to find the inspectors in the home. I think that that's really important. But just be open and transparent with the inspectors. They really just want to talk to residents and find out how things are going. That's their aim. Tammy, I don't know if you had any other thoughts on this.
Yeah, no, it really is that. They just want to get from your perspective what is happening in your home. And so, just like Al said, being open to that. The other thing you could do is if it is a proactive inspection and you're aware that it is a proactive inspection, you can approach the inspector if they haven't already to set up a time that might work well for you, or if you know you're not going to be in the home perhaps at certain times. So that's okay to do that as well. And then the other thing is really just having, if you are interviewed, just having the resident council meeting minutes available for the inspector to go through. Sometimes if that's available during the interview and you specifically want to reference something, sometimes that's helpful. But other than that, it's really what Al said, just being open to having that conversation and just really telling them truthfully what you are aware of about how things are happening in the home.
Thank you both. Now I know I've worked with the previous resident council president who found a way to help him stay prepared was to actually have a binder, his own
Yep.
copy of the binder in his
Yep.
room that had copies of all the minutes. He would flag if a meeting had to be canceled or moved and why, so that if there's any questions about that. We even went through together in preparation to show where we reviewed the menus and got resident feedback about the menus and snack times. When we reviewed the annual resident experience survey, because those are the kinds of the minutes are being scrutinized by the inspectors, and it helped our resident leader be more confident that he knew that we were compliant. So I think to take some of the fear out and to empower residents to know that they're doing that. Also, I'm not sure if residents might even want to see a copy of the interview guide that is available. Like there is a resident council interview guide that the ministry uses as kind of a jumping off point for conversation. We used to practice with the old inspection protocols, just so residents could get a flavor of some of the questions that might be asked. So really just letting people know it's a conversation, it's free flowing, as you said earlier, Tammy, and that if it is being recorded, it's just more for transcription and reference. It's not meant to be scary or punitive.
Yeah, exactly. And when you reminded me, Melissa, the other thing is that some homes will have separate food committees from their residence council. So if you have a food committee that's not part of your resident council meetings, you should really let the inspector know, because then they're required to then go speak to a member of the resident food committee and look at those meeting minutes as well, just to ensure that the follow-up to those specific things are being met as well. And the other thing, just to add, is sometimes people will find it helpful is that after the meeting, if there are concerns or something that they think might be interesting to share with the inspector, is flagging it at the time, like shortly after the meeting, so that you know, it's you don't have to try to remember back 5 months or flip through and try to prepare, that it's just kind of handy and already fresh in your mind when you're making the notes. But yeah, thank you.
And then just one other point, because I really want to kind of send this point home, is at no point when an inspector is speaking with a residence council member or the president, are they appraising the actions of the residence council. Their sole aim is to say, is the licensee doing what they need to do to assist the residence council to operate? Like that's the appraisal. They're never judging any member of the residence council. We're really looking to see, are the staff in the long-term care home or the leaders in the long-term care home doing what they need to do in accordance with the regulations? So I just want to make that really clear. We're never appraising the actions of the council itself.
Thank you.
If I can just, before you do anything, Melissa, go back to the original question I'd asked about how often, is how many homes does each inspector have on their list?
So I would say that we don't like assign a portfolio of homes. We have 7 different districts. Our ratio of inspectors to long-term care home is somewhere around 2 inspectors for every long-term care home in the province. So they wouldn't have typically a portfolio, and as the residents will recognize, inspections often occur with a number of inspectors at the same time in the long-term care home, so that there may be 2 or 3 or 4 inspectors, and sometimes just one. But it depends on the circumstances, you know, how large the portfolio of inspectors is in a certain inspection.
So there's no fixed inspector per home?
No.
Okay, just, okay.
And the other thing is well, we have different, you know, districts and regions. We all work as a provincial program. So, you know, I might have some of my Toronto inspectors visiting Thunder Bay or Kenora, or, you know, or different areas of the province in Ottawa. So while inspectors are generally anchored to a certain district, it doesn't mean that I won't have inspectors flying across the province to go and deal with an urgent matter or need. So we're sending resources where they're needed in the province at the time that they're needed.
Right. Thank you.
Great. I know we're down to our last 2 minutes. There was a great question that came through from one of our resident leaders. And there was a keen interest from residents to know what's happened, what ideas and findings are being generated through the inspections, and knowing that we're moving towards kind of a leaner approach with more timely identification of and communication of any areas for improvement. The question is, could resident council or a resident representative be included in kind of that exit interview or the exit debrief, so that maybe clarifying questions could be asked or that residents are in the know? I know sometimes some confidential matters might be covered, but I'm just wondering, I know some homes have gone in that direction of having resident attend a portion. So any thoughts on that?
Yeah, 2 things. So you're correct. Sometimes those exit debriefs will have resident confidential information in it. But the resident council president is at any time can ask the inspector the results of the inspection, and the inspector can meet with the residence council when they are finished as well and review the information of what the findings were without kind of that public health information and protecting those pieces. So there's still an opportunity there for all of that information to be shared directly with the president, and then that way they're able to then share that information with the rest of the residence council. So yeah, at any time they can absolutely ask the inspector to share that information with them. I'm not sure, Al, if there's anything else.
Yeah, and I think the relationship between the residence council and the licensee is really important as well.
Yeah.
And I think it's fair to have the residence council ask the licensee to confidentially. So there's always going to be barriers to sharing certain information about perhaps something happened to a resident, and the licensee has an obligation not to share that kind of information. But, the residence council may want to know what the licensee is doing in response to a report that the council just received, those kinds of things. And so our inspectors remain open to talking about where they can, what's occurred in the home as a result of the inspection. And I know that, I expect that most licensees were asked to kind of consult or have a conversation about the outcome of an inspection, that they should in kind be doing the same. They understand full well what the nature of our work was and what we discovered. And, we'd really like to know that they're working with the residence council to understand that information as well.
That's great. That's an important note to end on. Thank you so much to Tammy, to Al, to Andrew in the background who helped to put together this excellent slide presentation and has been supporting on the back end. And to your ministry colleagues who aren't physically here today, thank you very much for putting together such a thoughtful and informative presentation. I know this is it's a testament to how passionate people are about this topic, because there's a number of questions we didn't get to. So I know we talked about maybe working together on some kind of fact sheet or an additional resource to help residents better understand the process and have know what to expect. But I think we've really done a great. I think we've done a good start on this today, and we will be sending out today's recording and the presentation slides for your reference. I know we've also had a few requests about the inspection guides with the resident council. And so we will try to track that down as well to share. And I just wanted to share that OARC is in touch regularly with our ministry partners. So we have an ongoing relationship. And so with frequency, we are bringing resident feedback to the inspections team. And we are also actively involved in training, in the helping to bring on new investigators and inspectors. So the resident voice is infused at the training. So, and we really welcome those opportunities to work in collaboration. So thank you for spending this last hour with us. And we look forward to staying in touch and continuing the conversation and education around inspections. So thank you very much and have a great afternoon.
Thank
Thanks.
you.
Thank you.
Thank you for having us.